Have you been feeling a little less vibrant, a little less sharp, and maybe a little less like yourself? These could be some hidden signs, stealthy signs of low testosterone. A lot of men and people in general understand that testosterone affects your sexual health, but it's also pivotal to things like energy, mental clarity, mood, and even physical strength. These symptoms often come on gradually, and so they're easily overlooked or misattributed to other things. My name's Dr. Taranella, and in this video, we're going to look at the more nuanced warning signs of low testosterone. We'll draw on my 15 plus years of treating men with low testosterone, plus some research to back us up. If you're finding this information useful and valuable, please hit the like and subscribe to continue getting videos like this. All right, let's delve into the warning signs of low testosterone. So the warning signs of low testosterone can manifest in a lot of different ways. There's numerous symptoms or signs that come about from low testosterone, ranging from things like low energy, low mood, cognitive problems, physical and mental abilities like decreased muscle mass, inability to do your daily tasks, daily work, etc. And it also comes on gradually or subtly and progresses over time to more intense symptoms. And this kind of gradual onset kind of gets at what the problem is with these warning signs is they come on gradually, so oftentimes you can attribute them to other problems like simply aging or something else entirely is going on, like perhaps you have depression or something like that. So that's part of the problem with the warning signs of low testosterone is they often get overlooked or can be misattributed to other things. For example, oftentimes low testosterone can look like an anxiety disorder or depression or a sleep disorder or simply aging. And so your doctor may not even check or encourage you to check your levels. And so recognizing these symptoms and signs can clue you into getting checked and getting treatment when appropriate to improve the quality of your life and preventing further deterioration of your health. So one of the first obstacles to getting an accurate diagnosis and treatment is blaming the symptom that you go in for on something else and not even having your testosterone levels checked. And low testosterone or deficiency in testosterone, the symptoms often creep on slowly. And so it's fairly easy to just say, well, I just haven't been feeling quite as good. And there may be other things going on at home or at work that you can say, yeah, I'm more stressed, things like that. Problem is when you have lower testosterone, your stress tolerance also is going to go down. And so it seems like things are worse. In addition, the gradual onset over time makes it hard to connect the dots between what's going on at work, what's going on at home, and how you're feeling day to day. That is until it starts impacting things more globally. And then the last mistake or obstacle that I see common is that we can attribute the symptoms of low testosterone to like a poor diet, lack of exercise, consuming too much substances like excessive alcohol. Things like simply not sleeping enough can lead to low testosterone, yes, but also leads to the symptoms of low testosterone, mainly being fatigue. And we're going to address all of these specific symptoms here in a minute. But first, I wanted to give you that context window to understand why people seek out testosterone and some of the other reasons that they may have been given for how they're feeling. And a lot of times the treatments that are given for like depression is only going to address their symptoms a little bit, but not fully improve how they're feeling day to day. So I broke the low testosterone signs and symptoms into two different categories. The first is going to be those that come on early and are almost always there. And then the second category we'll talk about is the ones that come on later and are there when there's more ongoing low testosterone levels. So first, let's look at the early onset or most common symptoms to watch out for. So number one symptom that is almost always present is low energy or fatigue. And this is by far one of the most prominent symptoms that I see. And sometimes it will show up as lack of motivation or a sometimes irritability to complete jobs or complete work. And this lack of motivation is going to show up as like maybe feeling a little bit more irritable, maybe feeling a little bit less motivated to get all the things done on your list. You're probably feeling like your list is starting to pile up and you're just not interested in engaging on those tasks, doing the bare minimum. And there's obviously a range of this. Some people will state that they come home and they just want to lay down, even take a nap for 20 minutes before they can get up and do anything. Other people are just noticing that they're they're going to bed earlier or they're dragging throughout the day. And so there's a spectrum of this low energy or fatigue that will manifest depending on, one, how long it's been going on, and two, how low your levels actually are. And with this too, you're oftentimes going to have a kind of mental fogginess and inability to focus. Maybe your memory is going down, and maybe some depression along with this. And we have to remember from the standpoint of depression that testosterone increases neurotransmitters like dopamine and can directly influence and uplift our moods. But dopamine is also important for memory recall. It's used for attention deficit. And when we're lacking dopamine levels, we're going to be less attentive and less remembering of specifics of conversations or things we need to do, etc. And along with this, there could be mood swings. We talked about anxiety and depression, but there can sometimes be a more deeper sense of depression, like a sense of hopelessness, lack of interest in life comes to mind. With lower energies, it can also manifest as mood swings. You may be really low at one point and then just be really irritable and angry on the other side of things. So you can have kind of vast vacillations in your mood from one day to the next, or even one moment to the next. The next symptom that I commonly see, and this may come on with more progressed stages of low testosterone, but it can show up early on as well. And that's just decreased strength and decreased ability to do things I normally would do. So that could be physical power or endurance. And this is common because there's literally less testosterone in your body. And so many people don't know this, but a lot of times, almost within a week or 2 weeks of injecting the testosterone, people that are doing workouts regularly will notice that their strength increases almost immediately within the first couple weeks. And that's because the testosterone is allowing for more of the muscle fibers to engage in the work that you're doing. So you become stronger quite quickly when you're on testosterone replacement therapy. And that kind of gets at another common thing that happens is there's redistribution of fat when you have low testosterone, or accumulation of fat around the belly, sometimes around the chest area as well. And that's common with aging in general, but part of that is from the lower testosterone levels because you're not engaging those muscle fibers. Sleep issues are another common thing early on, but it can manifest as trouble falling asleep or trouble staying asleep. More commonly, it's going to be trouble staying asleep, I would say. And this is common with higher stress anyways, but because testosterone can work like a mood stabilizer, it can help you deal with stress. It can lower that cortisol and help you sleep better at night. Now, the flip side of that, as I've discussed in other videos, is too much can actually make this worse. Same thing with mood. So you'd have to be careful and judicious with your dosing if you're having sleep issues. The last one that I'll cover here on the early onset is decreased libido. So libido is your desire to actually engage in sexual activity. And it's common with low energy that you're not going to have those reserves to do some of the extracurricular activities, if you will, like engage in sexual activity. So when you have lower testosterone, the energy is going to be lower and you're just going to be less interested in that kind of activity. All right, let's look at the later onset symptoms, or the more severe symptoms that come on with low testosterone over time. So oftentimes we don't think about hot flashes as being common with low testosterone, but males do get hot flashes, and those are going to come from high estrogen symptoms. And so when the amount of estrogen relative to the testosterone is much higher, you can oftentimes have hot flashes. That's not a common symptom, but it does happen. And sometimes too, along with that, you can develop some increased breast tissue, also known as man boobs. And the higher the estrogen levels relative to the testosterone, and the longer that goes on, you can start to get some increased breast tissue, usually around the nipple area is going to start to protrude, and that's classic gynecomastia. Loss of body hair is another common thing that you'll see, and we're talking about body hair, we're not talking about the hair on your head. Testosterone will make the hair on your head fall out more, but low testosterone, or not enough testosterone, is associated with decreased hair on all areas of your body. So a lot of times it'll show up on the lower legs, but it can be on the arms or any part of your body. Erectile function, I put it in this category here. Of course, it can happen for a lot of different reasons and can happen at different stages. But when it comes to the role of testosterone in erectile function, it's going to affect the ability of the arteries to dilate, because part of what the testosterone is doing is increasing the nitric oxide, and nitric oxide is what allows the arteries in the penis to enlarge or dilate. So with that, you get more blood flow. Now, the reason I put it in the second category is just because as we age, it's more common to see erectile dysfunction issues, but it certainly can show up at any time in your life. And especially if you're having a lot more mood issues, I think it's more common to see low testosterone causing ED. And the last symptom or sign that we want to cover here is loss of muscle. Muscle reduction despite exercise is common as testosterone testosterone levels decline with aging, and you may be doing the exact same exercises with the exact same weights, but feel like you're losing ground, meaning you have to drop your weights or you're getting injuries more often and you're less strong and able to maintain or even progress in your workouts and exercise. That's common as our testosterone levels go down, but it's oftentimes something that you see as you get older and not something you're going to see as much when you're in your early 50s or even younger. So why does this happen? Why do we even get low testosterone to begin with? Is it inevitable that this is going to happen? Well, yes and no. It doesn't seem to happen equally in all people, but as we age, for sure, your testosterone levels are going to decline, and for sure, your free or bioavailable testosterone is going to go down. But it certainly doesn't happen equally in everyone, and certain lifestyle factors can accelerate this or make it more common to occur. But there's two types of low testosterone, or reasons, categories, if you will, that we get low testosterone, and one is called primary, where your testes are failing to respond to the signal from your brain, and the other is secondary, where your brain actually isn't sending enough signal to the testes. And that's where the hypothalamus and pituitary gland are skewed in terms of their response to the testes. A lot of times that's coming on from stress or sometimes substance abuse. Other factors could be playing a role as well. So far, we've been discussing mostly my clinical background and observations with treating people with low testosterone, but is there actual research that shows these signs, symptoms, and problems come up with low testosterone? Well, yes, actually, there's lots of research on this, and it's not too hard to find if you look for it, but I'll just lay out a few of the things that I found when doing a little research for this video. Low testosterone is definitely linked to higher rates of depression and mood disorders and also cognitive impairments. So that's a associative link, but in my practice and experience, there's a direct causal link there, meaning when the testosterone levels improve, the cognitive function, depression often resolves or gets better as well. It's not going to happen in every single case, but if you're low and you have those symptoms, there's a good chance it's going to get better. Some of the more physical symptoms like erectile dysfunction, increased fat, decreased muscle mass, there's definitely studies showing that low testosterone, you're more likely to have metabolic syndrome, decreased muscle mass, increased fat mass, and decreased sexual function. And I've certainly seen this in my practice as well. So this should leave very little question on whether or not testosterone replacement therapy can resolve some of these symptoms and signs that you might be having. And if you have more questions about some of these specifics, whether it's on dosing or whether or not you should or shouldn't start testosterone replacement therapy, you might want to check out our playlist on testosterone replacement therapy. There's a lot of information on there. I'm also considering making a guide to testosterone replacement therapy that helps you better understand and sort through what you should be doing in different scenarios when you're on testosterone replacement therapy or have low testosterone. So if you're interested in that, leave it in the comment section. That will encourage me to move forward with that project. So here's the key things that you should take away from this video. Low testosterone can present in a pretty broad range of signs and symptoms, from fatigue to physical changes like muscle mass changes and even hot flashes and fat redistribution. So it's crucial to recognize these signs, as they can easily be misattributed to other things because of their gradual onset. There are lifestyle factors that can both cause low testosterone and also exacerbate some of the symptoms. So that's why it's important to actually get evaluated and look at what's going on in your blood to determine what the best course of action is. In some cases, you can just change some of these lifestyle factors, and within a few weeks or within a few months, your testosterone levels may be a lot better. So it's important to get a firm diagnosis and go to your doctor and make sure they're running all the appropriate tests to help you differentiate between primary and secondary low testosterone. That, of course, is also going to change the treatment strategy. So if you think you have low testosterone based on this list or something else you've done, and you haven't really tried to change your lifestyle, some very basic, easy things you can do is make sure you're getting quality 8 hours of sleep to the best of your ability. And you should stop using any substances like alcohol, THC, things like that. And you should definitely be lifting more heavy weights. That's going to send the signals to your muscle, which then sends a signal to your brain to start cranking out more stimulus to the testes to make more testosterone. So hopefully this video gives you a better understanding of what the warning signs are are of low testosterone. If you do have any follow-up questions on this, drop those in the comment section. I'm more than happy to answer your question. If you want a more customized, usable answer, you can consider joining the membership program, where I will dedicate a lot more time and attention to answering the questions that you ask. Now, one question you might be curious about after looking at this is, what are the dosing and dosage considerations for testosterone replacement therapy? And there's a nice detailed video on that right here. Thanks again for watching. We'll see you next time.